It's common after prostate cancer treatment for men to develop some difficulty controlling their urine and some difficulty with their erectile function. And so it's very important that men are proceeding with Kegel exercises or even pelvic floor physical therapy, which are exercises to strengthen the muscles around the urethra tube and help to control the urine. It's also very important to proceed with penile rehabilitation, which is the concept of taking a low-dose medication every day to help stimulate the erectile function and the blood flow to the penis. Just like we recommend that men see prostate cancer specialists for the treatment of their prostate cancer, so should men seek out men's health specialists for the treatment of some of the side effects of prostate cancer treatment, such as urinary incontinence and erectile dysfunction. Prostate cancer can have a number of impacts on our sexual function. The nerves that are responsible for our erectile function run right along the top of the prostate gland and are commonly stretched or injured during surgery for prostate cancer or during radiation treatments. The prostate gland also produces the majority of the fluid that comes out at the time of ejaculation. So it's very common for men to see a decrease or absence of that fluid despite feeling the sensation of orgasm after the treatment of prostate cancer. So there are a number of ways that prostate cancer can impact our sexual function. One of the things that the prostate gland does for us as men is it helps to hold urine in our bladders. Sometimes it does too good of a job of that and we have difficulty urinating, but after treatment for prostate cancer, particularly if the prostate's been removed, we may have some difficulty holding urine in the bladder, leading to urinary leakage that may require the use of pads or in some cases, diapers. Recovery from prostate cancer treatment can take several months to complete. We know that men are not going to be at their final destination in terms of their urinary control and sexual function after prostate cancer treatment for as long as 12 to 18 months after they've undergone treatment. So it's a long process that we are here to help with along the way. The most important thing that we can do to speed and facilitate recovery is to be honest with your doctor. If you're having problems controlling the urine, please let us know that. If you're having difficulties with the erectile function, please share that information with us. That will help your doctor get you to the right person to talk about what our options are for recovery, because we do have many good options to improve these side effects. The only restorative procedure that is available for erectile dysfunction is the placement of a penile implant, which again restores the erectile function that is so commonly lost after prostate cancer treatment. The best long-term cures for difficulty with urinary continence after prostate cancer treatment is a discussion about placement of a sling underneath the urethra to help restore the support that was lost at the time of treatment. In other cases, we discuss placing what's called an artificial urinary sphincter to help control the urine flow and prevent leakage. So we have great options that can provide long-term improvement in urinary leakage. One of the most common things that I hear from men after prostate cancer treatment is that they lose some penile length and girth. The reason this happens is not because of a loss of our sexual erections, but because of a loss of the nighttime and early morning erections that are key to maintaining the health of the erectile bodies of the penis. And so use of low-dose phosphodiesterase inhibitors, pills that are taken typically once a day around the time of surgery to help stimulate blood flow. Those are so important. The use of a vacuum pump is common, particularly after surgery, to help stretch the tissues, to help stimulate the blood flow to the area. And if those efforts at our erectile function are not successful, it's common for us to discuss the placement of a penile implant to help maintain that length, minimize further length and girth loss that unfortunately can happen after prostate cancer treatment and with erectile dysfunction. We know that prostate and prostate cancer health is the same as heart health and health of our bodies as a whole. And so we recommend things like exercise, at least 30 minutes a day, at least 3 days a week of cardiovascular exercise. Not only helps to improve our blood flow, but helps maintain a healthy weight, which can help us at the time of prostate cancer treatment if necessary. We know that a diet that is limited in saturated fats and simple sugars is the healthiest diet not only for our hearts, for our blood vessels, but also for our prostate health.